actually in our home. We're teleworking, but I wanted to say welcome to everyone. I will field the questions. We'll field them afterwards. If you'll just type them in the chat box there on the right-hand side when you when we get through with the presentation. Uh, I talked to Kathleen Davenport, and she wanted me to share a couple of things. One of the things is that 1.5 billion back will be coming in late October, calculated at 100% of the 2019 true up. One thing that is there's a deadline for true up right now of 8/15, so we're a little bit late, but make sure you get your true up in for 2019 to be eligible for that rebate. Also, I wanted to share that round two will be coming in as far as the facial masks that BWC is offering to employers. They will be sending those out sometime coming this fall. You should have already gotten round one. I know that a bunch of employers had those sent to them, and they should be using those right now. So we'll be sending a round two out also. Another thing that I wanted to share, and I'm going to put my share screen on, is I figure I would show you a little bit about the new website that has been launched by BWC. I don't know if everybody can see that. Christy, can they see that okay? Is everybody see that? There is, if you go to the original BWC website, it has a thing for employers and then safety and training. And this is the one for safety consultations. So if you were going to look at safety consultations, one thing that we are doing right now is we are doing virtual safety consultations because of the teleworking agreement and the state of Ohio. We can do virtual safety consultations via Teams or that's Microsoft or Zoom. And if you have an iOS system, an Apple system, we can do it through there via the phone. The way a virtual consultation would work would be we could either do it live at your facility or your location. We can review some equipment. We can do a virtual walkthrough. They seem to work pretty well. It's just getting used to some of the applications, obviously. We are also doing virtual consultations with some management. We are offering on-site training. That's something that I will offer, especially for my employers, that we could do a PowerPoint 1 hour, 2 hour presentations on specific topics. So I just see that our main speaker is just getting ready to join us too. So I will also share one other thing that I wanted to share is that we're doing webinars. We're doing monthly or webinars weekly. And I wanted to just share you what we're doing as far as September webinars. Hopefully a few of you have joined our webinars. We have one that's scheduled for September 1st with temporary workers. If you have a health and safety, any issues with temporary agencies, this is a great one, and the instructor is Tom Bloom. Everybody familiar with Tom Bloom because he was actually the BWC rep last year. Mary Beth Holly has one that talks about managing contractors on September 8th. And you can actually see that these are 1 hour webinars. You can see how to register. And there's a one for hazard communication. And then what's wrong with fire hazards. And this is actually a partnership with the Ohio Fire Marshals. And then there's another one on heat stress. So you can see these are going to be offered, especially with the way we're doing things now, doing virtual. You're going to see a lot of webinars that are going to be available to you. Again, register for them, and hopefully I think that's all I have, Christy. Thank you.
Good news is Jackie's here.
I can only do song and dance for so long.
Look, oh, kind of. I'm here, kind of. I might still need you, Ben.
Okay, well, I'll field your questions.
Just take the hook. Take the hook away. All right, Christy, are you going to
I'm going to introduce you now.
introduce me? And did you see if
I accidentally put our live onto my personal Facebook, so I was trying to get that going. So hopefully that is good to go. But anyhow, I am so happy to introduce Jackie, who I consider a friend and colleague. She is Health Commissioner of Middletown City Health Department, and she's been there for a long time, but been in healthcare for more than 30 years. She joined the health department in 1997, actually, when I was working there and worked under a cardiovascular grant. And then she has moved up that ladder as director of nursing, vital statistics registrar, and now the health commissioner. She has extensive training in all aspects of homeland security, bioterrorism, emerging diseases, public information officer communication, which has utilized all her skills here the last 4 or 5 months, hasn't it? And then she also is on numerous boards at the local level, county level, and state level. She received her master's in public health from Wright State University, her bachelor's of nursing from Miami University, and her associate nursing degree from Kettering. She brings a diverse knowledge and perspective to public health, and she is just truly immersed in our community here in Middletown and beyond, and we look forward to having her here. And she has been here before, so many of you may remember her. So Jackie, without further ado.
Okay, and Christy, are you going to share, or did you figure out if I could share this screen?
You should be able to share. If not, I can.
Okay, I'm going to attempt to do it. Let's see.
We did practice this. So
okay.
It should work.
So do you see it?
I do.
And then I got to find a way that I could just do the slideshow. Let's see, from beginning. Yay!
Wow.
Okay, cool.
All right.
I'm getting smarter and smarter. No, I'm just teasing. Okay, before I get started, Christy or Ben, help me out to slow my roll. I'm going to try to get through most of this information as quickly as possible so that we can allow as much time that's left, and I apologize for being late, for questions that you may have. But this presentation was prepared, I think we've kind of start preparing it Monday. We kept trying to update it, and the numbers are changing as we speak. So some of these may be 24-hour ago numbers. But as I try to do this, yes. So I try to put the numbers, and these are global cases, confirmed cases, and then global deaths, and then US confirmed cases and deaths. And then the next slide will be our Ohio cases. Christy will have this PowerPoint to share with you, so feel free to not try to get it all at one time and read it, and then feel free to contact us if you have any other questions. But Ohio cases were 116,495. Ohio deaths, 3,996. A lot of people wonder about those deaths, and those deaths, we were told to report them if the doctor felt the need to find COVID a significant cause. So that means it would be on the death certificate. Some people die in car accidents, gunshots, stab wounds, or whatever, and they could be positive as well. So we have some COVID cases that die that is not in this number. This number should only be on the death certificate written by the physician that thinks it may have a cause or related cause to COVID. And also the state is doing this advisory system, and it really just gives people some idea of how much activity they're showing in the counties. It really doesn't make a start or stop anything. However, if you see people get ready to get into that purple level, you'll get a red, your county would be red, and then you will have a purple star, which means you're very close or on the borderline of becoming all purple. And then if you turn purple, I'm sure the governor will then start saying what he would kind of advise us to do. But what he wants local level people to do is already have something in place that if you see that your county is turning purple, you kind of know what to tell your staff or your employees, or how you can be maybe more aware of what you may want to do. Purple would be really a public health emergency. The spread is severe. And so you would want to maybe let them work from home. You would maybe want them to really enhance or really start watching their symptom checks. You may want to make sure if people travel, they don't come back to work. All those things that you advise your staff to do, this might be mandated for you to advise your staff to do. And this is the numbers for Middletown and Butler County. So Butler County, and this was, I think, prepared as you see the 25th. So 3536, so 3,536 confirmed cases. Butler County, deaths were 69. Middletown cases was 467. That has changed already today. And our deaths was 7. We've already had another death. So we're really at 8. With 1 pending. I'm sure you guys have heard about the 9-year-old girl. So that one is pending. That may make it then 9 deaths. We try to break it down a little further because, you know, people are wondering just kind of where we've seen some of the cases. And so our cases over the last 2 weeks, we've seen about 25% of those Butler County cases were Middletown. And so I was listening on the governor's call, so some of these larger counties, Clark County has a population of 134,000, and they were seeing something like 76 cases a week. We're pretty much seeing 45 to 48 cases a week, and we have, what, 3 times less that population. So although it doesn't sound like it's a lot, it really is a lot of cases per population. When the epidemiology or ologists are doing this, they try to do 1 case per 100,000. So you see how that would kind of wait for us to get to 100,000 because we have to double our population. But if you look at Butler County cases and us having 25% of their cases, it is kind of concerning since Butler County's total population, I think it's like something like 302,000. So you can tell I don't do this often. Okay, I didn't know my mouse could roll and I could do it that way too. So the next slide, we're trying to bring it closer to home for people that are in Middletown. So we're doing this by week. So if you see on the number at the bottom, that's July 8th through the 14th. So that's weekly cases, 32, 31, then it goes down to 22. We had our highest week at 48, 37, 45, and what we're trying to look for is a trend to see if our hospitalizations, and that's in the green bar, are going down, going up, or staying the same. And then we're also trying to get weeks of continuous decline. And so we can see that our virus is going away, or at least standing at bay. So what we really want to see, I would be happy if we could get down to at least 22 a week or less, and that would be really good. When I was first talking with the schools, we were seeing anywhere from 3 to 5 a week, sometimes as high as 7. So the schools and I were saying, oh, good, we're going to open up the schools and we're going to do it safely because we had such a low viral load in our community. So we thought we quickly exceeded that because July, we're thinking July 8th, a lot of things kind of happened. We had the 4th of July. We had a lot of reopening. We had protesting. We had different events that would cause more community spread. And so we can kind of expect maybe with Labor Day a couple of weeks away that this number may continue to go up. Okay, let's see. And I'm going backwards. Okay. And so this again is another trend that we're doing, the blue case counts. That trend line looks like it's going up. What we want to do is take it the X's and start going down. So we're hoping for that. But this one talks about how many cases are in city schools, because I was working with the schools saying, if we have a lot of positive cases, how many may be kids. If you guys can remember when this first started, we were seeing a lot of cases and they were in the nursing home. So they were either the staff of the nursing home or elderly. So we were seeing a lot of older people. Now with the reopening, people getting out, sports, etc., we are seeing a lot more younger people. I think our median age now is like 42, 44. This is just another one I threw in there. It just shows you that if you want to let your staff have a chart like this, I think this came from Texas, but they were saying just be informed, know your risk. So it kind of tells you some activities that are higher risk or lower risk to do. You can use this also like I often do. If I look at my week, and if I'm gonna have a lot of meetings, a lot of activity, a lot of encounters with different people that is not in my household bubble, I kind of look at and I kind of assess my risk, and I try to take some of those things out. So your employees can do this or use this. If they're going to a wedding in a couple of weeks, they may want to really kind of lower their risk for those next couple of weeks so that they don't bring COVID to the wedding. And so that when they get there, they haven't done multiple different large activities, that just adds another risk. Because we know this virus likes a viral load. When they take samples, they can see how many viruses is in your body. Just like other diseases, we constantly see other viruses and bacteria and germs. But when you get a high viral load is usually when we start seeing illness. And so these are some of the things you can just look at that's high risk, low risk, moderate risk, and how you can have your activities. If you have new babies at home, a lot of people are doing, if you want to see grandma and grandpa or mom or dad, these are the kind of things you can kind of say, how risky is my activity? And it's just a good guideline. Now this one is maybe hard to read, and I have, like I said, I've given this to Christy. I can tell you where I found it. It is on almost everything that we use is on the CDC website, but this one is a really good slide because everybody wants to know what to do if they've been in contact with a positive. We all know that positive cases should stay. Once they're positive, health department gets in touch with them and they give us their contacts. But you know, often some people don't give us all the information. Sometimes we can't even get in touch with some of the people. So with that said, if people hear that their fellow co-workers are positive, or if they hear that they're around a lot of people that might have been at an activity that was a positive, you know, they were finding a lot of positives, these scenarios kind of gives you some of the guidelines of what to do. If you've had a close contact with someone that's COVID and you won't have any other further contact. So that's like if you did go to a wedding last Saturday and the bride was positive and you only went because it was somebody's friend or whatever, and you'll never see the bride again. So they tell you one of those kind of contacts. But if then the bride happened to, you happen to live with the bride, or you happen, because it could be your daughter or a cousin or a sister or whatever, and you're in closer contact, what you should do. So it gives you different scenarios. Often CDC, and these guidelines, CDC considers a close contact someone that you are closer than 6 feet to, and you were in that close contact with them more than 15 minutes. And also, if you had a mask on and if you were inside, makes a difference too. So when we start talking to people about close contacts, we assess all of that risk. My office, you guys can see the door closed, so it's a small office. If someone was in here with me, no mask on, 15 minutes, if we were going over budgets like we often do, that would be considered a close contact. If we put on a mask, it would be better. If I opened the window, it would be better, or open the door, it would be better because you have some circulating air, but it's still considered a close contact if one or the other person became positive. So we really should go to a bigger room, sit further apart with our mask on, open the windows if we can, kind of reduce our risk. But this is pretty cool because it kind of circles on your calendar. You count the 14 days from the time that you're exposed to the person, etc. So this is some good information. But if you just Google CDC quarantine information, all of that information is on there. They give you signs and symptoms of COVID, Right now, we are seeing a lot of asymptomatic people, or we're seeing a lot of people, if I can't tell you how many times, that said, I thought it was sinuses, because they have a hoarse voice, kind of like mine is now. I keep thinking I have COVID every time I talk to people, but that's what nurses do. So they have headaches, runny nose. The runny nose is kind of like a clear runny nose, pressure behind the nose and the face. So often it sounds like a sinus, but then they will get a fever. They go on to get body aches. We're seeing a lot of body aches. I talked to a doctor actually that said he played golf over the weekend, and Monday and Tuesday he was still sore. He said, I didn't think I was that out of shape. But then he started getting a little fever and a scratchy throat. He got tested, he was positive. So some of those kind of things you want to just watch for. We're also seeing abdominal pain, diarrhea, loss of sense of taste and smell. A lot of people are saying that they can't smell things or taste things. Or they said a fire guy said that he was putting on cologne and he noticed that he couldn't smell it. So, because he felt fine in the other aspects. So make sure that any of those kind of symptoms you might be aware of, and then you may tell your employees to call in and let you know. And with that said, too, you really need a good policy of what and how your employees can be off work and what kind of time they use, etc. But this is just some background. In the beginning, we were seeing a lot of long-term care facilities. We're starting to see that again. That's why we have a lot of National Guard, and the state is going into the nursing homes to help assist with keeping the infectious rate down. Because remember, most people in nursing homes have not been out of that nursing home. So these cases are coming in from the community, from the staff people. Also, family spread is almost inevitable. Unless you can really separate yourself, most families go on and become positive. That's why when we quarantine a household, we quarantine the whole household. It's still good to try to stay away from your family members. Unless they're really small, it's hard because you just don't know how this virus will affect each individual. But we pretty much know that the household becomes, really, really, really close contacts. Let's see here. Medium age of the households is 41. So that's what we were saying before. We're seeing the cases come down. And 20% of these cases have been hospitalized. So for people to think that younger people do not get it, that's false. That younger people do not get as sick is false. And younger people do not get hospitalized, because we are seeing those situations. Of course, we're not seeing them as much as older people and that people that have comorbidities, because any kind of virus or illness is always harder on a body that may be fragile. But we are seeing some people that are being compromised a lot. The age is shifting. In the workplace, most of our people that we followed in the workplace are asymptomatic and or they thought it was sinuses. And so there again, it's really important. I just left a staff meeting and I told them that our staff, our city staff, think we need to beware of the public. And when they get behind the scenes, they take their mask off and they don't think their coworkers can give you COVID. And those are the ones that's probably going to give you COVID, because the public should only be in your face less than that 15 minutes. And we're making the public wear masks, etc. But when they get behind the scenes, they take their mask off, they're talking with their coworkers, they're eating in their space and their desk, and that's where the infection happens. So be really mindful of that. That's the reason why some of your workforce policies say remove that coffee break room, because people will congregate in areas like that. So that's what the reasons for that is. And then parties and get-togethers. We're seeing showers, birthdays, funerals. We're seeing anytime you get together with larger amounts of people, you're going to have more of an increase of spread and infections. So that's completely, the governor keeps wanting us to give them examples, but they're just all over. We had 3 known funerals this weekend, and we had cases from those known funerals. It did not mean that they had to get it at the funeral. What we're thinking is people brought it to the funeral and they exposed other people. We always put the slide up. If you ever see me not have the slide up, remind me. This is a accreditation slide that we make sure we let people, when we talk to people, if they want to know anything about the health department, how they can help public health, just call us. And it's always ways to help public health, getting the message out there, getting the real message out there, educating, helping us educate, etc. And always can give us money or hire us in another capacity, because I'm ready to quit. I'm just kidding. You didn't hear that, Christy. Okay. And then this is just a last slide here that we're trying to put up the message of make sure you protect yourself, wear a mask. The vulnerable populations, our homeless is a very vulnerable population. So we're just mindful that we, even if we're healthy individuals, we need to, and we're okay not wearing a mask, and we're okay going to large gatherings because we probably won't get sick. And if we get sick, we probably won't get really sick. We have to be mindful that other places in our community or in our families may not be as fortunate as us. So we always say we stand together while we stand apart. But I think that's it, Christy. Yay! Stop sharing. So Christy has this PowerPoint. I have multiple PowerPoints. I can always update them for you, or at our website, Middletown City website has a coronavirus like square that you can click on for the health department. And we try to update this every day between 3 and 5. So our numbers can constantly be updated for you. And the governor every Thursday updates that map that you saw as far as, I didn't speak about it, but the travel advisory and where the counties stand as far as if they're yellow or red or purple. So those are updated every Thursday from the state. And then our information and the state by the you know, for that reason is updated daily. But if you want that map, it's updated once a week on Thursday. So I will stop talking and entertain any questions, Christy, if you see any, or Ben, if you have any.
Doing that, I have one just in my, and I can't say I've known a lot of people that have actually been diagnosed with it. I know a lot of people think they have had it, but there seems to be, in the few people that I've had personal conversations with, it seems like they have showed symptoms 4 days after they were exposed.
That's correct.
Okay.
It's really weird. As we trace people, we always start with, can you tell me your experience with COVID? Why did you get tested? And it appears, and that's why that 14-day is really important. It appears that people are feeling fine. They get a sinus, something's going on, and then they hear something in the news, or they hear something that sounds like their symptoms. And by the time they call their medical, provider and get tested, and then the lab goes on. Remember, it's a couple of days sometimes before the results come, and they're positive. It appears that that's what happens, that people have really been infected maybe a week prior to sometimes feeling those symptoms. And then we are also finding that asymptomatic people, I really don't have any symptoms at all, have been becoming pre-symptomatic people, because when we check back on them, they start getting symptoms. So it's almost like, I've been around a positive, let me get tested. I've tested positive, but I feel fine. But then about 5 days later, it's happening like you're saying, Christy. Some of the fever, some of the symptoms are coming. So that's why we say if you're pretty much quarantining yourself for 14 days or 10 days from the time that you take your test, that's why all those days get kind of confusing. Yeah. You've pretty much have stretched it out enough that you shouldn't be infectious.
Okay, I have a question for you, Jackie, from CC. Why are people being tested that are asymptomatic?
Well, okay, and so this is the biggest craziness today. CDC came out today that now changes it, that asymptomatic people should not be tested. So let me go back to really around March. March, they were finding that, remember, this is a new virus, guys, and so if you think you're crazy, we're really crazy. This new virus, they were thinking we wanted to test only symptomatic people. If you all remember, testing was an issue. Remember, not enough tests, not enough labs to provide tests, not enough mediums to provide the test. So we only want to test people that were sick. That's how it started. But then as we started contact tracing and looking, we found a lot of people that, like Christy said, had never been sick. So we said we really need to start testing people that have been around positive people, or have, once we get enough tests, let's start testing asymptomatic people so we could tell them to quarantine themselves and stay away from work and stay away from sick people so they wouldn't continue to spread it. So that was what we've been doing. That's when our president said there should be tests for everybody. You should be able to get a test, because we really wanted to test our population just in case, to see how many people may have been asymptomatic and make sure they weren't spreading it on to mom, dad, grandparents, sick people, etc. Also, we found in those nursing homes, you guys, and in hospitals, a lot of our healthcare workers show no symptoms. So they're around those vulnerable populations, having surgeries, heart attack, taking care of those people, and they have felt fine. So we wanted to remove those people out of those healthcare settings if they were asymptomatic but positive. So that's why we were testing asymptomatic people. Now, if the way I strongly feel is, if you're getting sick, if you have any symptoms, you should be tested. And if you have been around a known positive, and you know, everybody hears it, I was and everybody's getting sick. I would want to know then if I was positive, because you can then go on and protect your coworkers, your family members, your new babies, your grandparents, etc. But just to be tested just because I want to know, I don't think that's necessary. But if you have reason to be tested, you're sick, you're going to go to a vulnerable situation, you know, I would say yes, be tested.
Okay, thank you. I have a quick question for you. Have you come across employers that say that the mask is now causing issues with, and this is also OSHA too,
Right.
Causing issues with being able to do the job safely? It may be interfering with another type of PPE that they might have to wear.
Right. It is exemptions for that. So in the rules and regulations, if your job says it does interfere with OSHA regulations, with your ability to do your work, you are exempt from wearing a mask. So you have to watch those areas, because they should not have to. But on the flip side of that, mask is a very big inconvenience. You can't breathe. You don't wear your lipstick. My lipstick gets in the inside of your mask, so you don't wear your lipstick anymore. I mean, it's a lot of reasons. My glasses fog up. I mean, there's so many reasons. My ears hurt after a while. I don't know about you guys, but it hurts my ears. So mask, and Christy will remember this, is probably as inconvenient as seatbelts, right? It wrinkles your clothes or whatever. So yeah, they're a big inconvenience. But I try to tell people to look at mask as in the sense where you're protecting yourself from to other people. So my mask keeps my germs to myself. That's one. And if you're around a lot of people, you really want people to protect you. And so I think it just protects all of us. So if at all possible, I would say at any situation that you're going to be within 6 feet for longer than 15 minutes with people, put that mask on. It's important to take mask breaks, because you know we breathe out CO2. We don't need that all the time. We don't need to keep breathing that in. So I'm in the office mostly of the day by myself. So I keep my mask down and I get that breath. If I'm like this, because I'm getting ready to go up to the bathroom, and then I put it all the way up. When I get ready to go outside, I'm like this. If I don't see anybody, then I kind of bring it down, but I keep it handy. And sometimes when it can't hang on your ear, I tell people, I put it on my wrist so I can always have it. And you guys, if you get used to that, you don't have to run out to the car when you go to Kroger's to get your mask again. So I just put it on my wrist to remind me. But yes, certain people cannot, they're exempt from wearing the mask if it interferes with their OSHA requirements. Because remember, you're keeping your germs to yourself. So if you're welding by yourself, no need to have a mask on. It's just when you're talking, close contact.
Right.
Hey, Jackie, there's a question that came in the Q&A from Linda. What if an employee is tested because of exposure and the result is negative, and then a month later gets symptoms? Could they be positive then?
Absolutely. Absolutely. And this is another thing too, quick. Remember that question, Ben. We are seeing that some people find out they've been around a positive case. Let's use last weekend's funeral. And they go right out Monday and get tested. That they may not have enough viral load in their body to get detected yet. So they tell you that if you think you've been exposed to a positive, you should really wait 3 days, especially if you're asymptomatic. You should wait about 3 to 5 days before you get tested to see if you in fact picked up that virus. Some people get tested too quickly. And I can give you a lot of examples, but we had a family that this guy got tested. Dad was positive and hospitalized. Mom took 2 sons to get tested. All 3 of them were negative. Then about 3, that was on a Friday. Then about Thursday-ish, they became positive. Started having symptoms, got tested, and they were positive. But when they got tested, when Dad first got sick and went in the hospital, they all 3 were negative. So again, you have to kind of give yourself a little time. But if people get sick, you guys, I can't say this enough. If a person's sick, they shouldn't be at work. It doesn't matter if it's COVID or not. And if they're not feeling well, they shouldn't be at work because they're exposing your staff to other things too.
Okay.
Yeah.
I just wanted to ask another follow-up to the question that I had asked is, what should an employer do if they feel that they have issues with the mask? Should they contact the health department?
No, with your employees?
No, your employer, if they have a question
Okay.
on, they're saying that the mask may interfere, right?
Oh, yeah.
They should get some sort of in writing is what I've been recommending.
Right.
From one of you to make, or one of the health department people that in fact that they don't need to, they can't wear it because of the business.
Right. Okay. So this is what I would tell you to do. In your business, if you should know what everybody's role is or task or what their job is to do. So you need to look at whatever they're doing to see if the mask interferes, right? If it doesn't interfere, and then we can work with you, of course, the health department can work with you with that line, and you can say they're welding. For instance, at McDonald's, if they're on the grill and it's hot, they don't have to wear a mask at McDonald's on the grill. It's certain places that they do not have to wear a mask. So we can walk through those places. However, if they just think, I can't do it because it's interfering with what I'm doing, and they're close in contact with other people, that would be a decision for the employer to say, you have to do this if you can't work alone because you have to protect each other. Or if they can't because of medical reasons, they need that excuse from their doctor. Okay. That wouldn't be the health department, that would be their doctor, because most people, even, it just pediatricists came out, just FYI, a lot of people were saying their kids had asthma. Pediatrician says that's more reason for your kids to wear a mask because they have a lung condition. So that's not an excuse. Asthmatic, a person is not an excuse to not wear a mask.
Have you seen, another question for you, have you seen a lot of outside work, construction workers, landscape workers that are working all day outside, not be in compliance?
Yes, and we've had a lot of outbreaks between tree trimmers because they're outside, they don't have a mask on, they usually are talking loud, they're talking close, and so they're spewing all of that. So we've seen a lot of outbreaks with those type of people, lawn people. But if they were being safe, they don't need to wear a mask if they're working alone, if they're in the same area, if they're being safe. So we caution them constantly not to be close, to each other. And when they're talking to each other, try to put a mask on or try to turn their equipment off. But yeah, we have seen a lot of people not being compliant. And when we get the complaints, we follow up with the employer. Yeah.
Okay. Thank you.
Here's a question. If an employer knows that, one of their employees goes on their own and gets tested, they're positive and they call in, I know they have to kind of figure out who they were near and all that kind of stuff, but they could contact you if they we're unsure of that? Or do you have anything written that we can share with them or anything?
We do. And I had sent this out to businesses, but Christy, I'll send it to you and Ben. But we had sent out, it's kind of, it looks like this. I don't know if you guys can see it or not, but, and I'll share it with you guys. But at the top, it says agency or business phone number, and then it says positive case name. And so you would put down Jane Doe, address, phone number, and date of birth. And then underneath there, it has ability for you to say contact number 1 was Jimmy Doe that sits next to her in the contact number 2. So it's good for employers to fill this out because they know their site better than we do. And they also will get real information because they know their site. What we do as a health department, you can have this at your ready. What we do as a health department, when we talk to that positive case, we'll want that. Who are you sitting next to? Who are you around? And they give us those contacts, right? Then we'll call the employer. Do you realize you had a positive case? And did you realize, because they should inform you all. And do you realize that she had said X, Y, and Z were her close contacts? And so we do work with people, but I'll send you this out. We sent it out to all the businesses, but you know how that goes. We faxed it out. So I'll send it to you guys. And it's a nice little tracer. We call it a contact tracer. And it's a nice little sheet because you could keep it in your HR so that if somebody else became positive, you can see that they may have been one of those close contacts. And so, yeah, I'll get that out to you.
Okay. Another question from Linda. What if employees refuse to wear a mask? They claim that it is not a law, only a mandate, and the police said they will not reinforce.
Well, if anybody looks up or talks to their legal advisor, a governor's order is a law. And right now they're questioning it, and legislation may want to change it, but until they do, it is a law. And so that's the only reason why the governor, when he mandates things, it's because he has the ability to enforce it. Now, whether local law enforcement do not want to enforce it is another matter. When we get complaints for businesses, we do follow up. The governor has given money to health departments to hire staff to enforce mask laws. Middletown, I just don't feel like we want the time and effort to have somebody come in here and enforce our businesses. We really want it to be something that people do and are compliant because they know it's the right thing to do. I don't believe in forcing people to be safe, just like anything else. I'm not going to call the police every time I see somebody without a seatbelt on. However, police have a lot to do. I know, Christy, you've seen what's going on in Middletown. They have a lot to do. So I do not tell my law enforcement to enforce mask wearing, even if they wanted to. But what I do is tell them to help us when people are serving liquor beyond 10 and 11 o'clock. I tell my law enforcement to help me because we have a relationship with our businesses, and I don't want liquor control to come into our community, like you've seen in Madison and other places, because I think we can talk to our businesses better. So I am trying my best not to have any outside influence come into Middletown because we have a relationship enough. And so to wear a mask, but you do have control over your employees. If you tell your employees that they must wear a mask, then they can be reprimanded. And that's what the city of Middletown has been doing. We've seen once the whole system said wear a mask, pretty much everybody wears a mask in the city of Middletown. Now they don't sometimes wear it back in their offices, which we're finding outbreaks and issues, but they are wearing them when they're out in the hallway, in the bathroom, and etc. So, yeah.
I have another question for you, Jackie. And you may have answered this, but it may be just as employers, are we required to report a positive COVID case,
Yes.
even if it's established that there was no close contact and the employees were wearing masks?
Yes, you're still required to report it. And it's only because we want to make sure, because your employee, you're worrying about the safety of your environment, right? We worry about the safety of the employees' contacts outside your environment. So when we contact trace inside your environments, and we contact trace in their community setting too. So I would want to know if you're positive, I would want to know what your household looks like. I want to know what church you go to if you do. I want to know what school your kids go to, and I want to know where you work, to make sure all of those areas in that positive life is covered, as far as making sure everybody knows. And remember, when I say everybody knows, we'll send out letters that says you may have come in contact with a positive case. We don't say Jane Doe is positive and you work with her. We let you know. So we want you to be aware that if you come down with signs and symptoms of infection, to make sure you seek care and to be careful.
Okay. Let's see, there's a follow-up with that. But if they were tested, and doesn't the lab notify the health department?
Yes, they do, but you guys have heard the stories. I have had people tested on August 12th, and the lab resulted a positive on the 13th, and I received the case on the 25th.
Oh.
Yeah, so when you hear all those problems about lab testing and not getting back, and there's certain reasons, real quick, let me tell you, it's a certain reason. Labs sometimes fax it to a health department, but if a health department has 400 cases sitting there, by the time they get to 395 to fax it to Middletown to let me know I have a resident, it may take 3 or 4 days. And so if you guys know, I've received a lot of we call it self-reports before those labs have dropped into our system. I appreciate that because we can start educating immediately and making sure everybody's safe. So yes.
Yeah. Any other questions? That we're getting thanked for bringing you. Jackie's
Yes,
awesome. She
yes.
speaks our language and is real and realistic about expectations and everything else. So I always appreciate that.
Yeah, and I was going to say, and go ahead, Ben. I was going to say, I was just having final words about what we're getting ready to get into as soon as I get off the phone.
They are asking for your phone number and contact.
Absolutely. And Christy has that, but I can give it to you. It's a 513-425-7854. It's my direct line. So you don't have to get in the loop of a tree. It's 425-7854. And of course, my email is Jackie P, JACKIE P, at one word, cityofmiddletown.org.
And we'll send that all in the follow-up along with the contact sheet and the PowerPoint.
Yeah, absolutely. That's good. And that's 513, of course. Yeah.
And the lucky winner of the gift card.
Uh-oh, you'll get that too. And yeah. I just want to tell you guys, we're getting ready to open up sports. We're getting ready to open up maybe performing arts theaters. We're getting ready to, I think they said open up bingo, but bingo's been open. And that's one of the things I did. I let bingo open because every other bingo was open. And I said, I don't see how that's different than a casino. So trust me, you guys, and Christy know this is true. If it doesn't make sense to me, I find a way that we can get it done safely. And if other people are doing it and call those health commissioners and say, how are you doing it? We don't want to make this hard because we truly are all in this together. But just remember, if you're older, if you have underlying conditions, high blood pressure, diabetes, heart disease, asthma, COPD, any kind of immunocompromised things, anything like that, lupus, those kind of things. Just make sure that you're protecting yourself because truly anybody can have COVID at any moment. And so if you're trying to stay at least 6 feet away from people with a mask on outside, less than 15 minutes, when you're in those kind of situations, you're pretty much keeping yourself safe. So you shouldn't be living on the edge or get scared when you find out somebody's positive. You should pretty much know that you've been in a safe position. If you don't have any of those, you're pretty much healthy and you're confident that you're okay with getting COVID or you might not get it or whatever. Just be respectful and mindful of people in your life and in your atmosphere, your workplace, that may be one of those people. And then that way, I think really and truly, that's the way we get back to normal and that new normal, because we'll be doing this for a little while, but that way we can get back to doing everything. If you look at these sport events, rules and guidelines, they're almost impossible to to follow. It was a game. We were told it was a game that they completely stopped. Referees stopped it. And over the intercom, they said, we will not begin play until everybody gets back where they're supposed to be. Because they couldn't control the crowds. They were going all over. And they literally just waited. All the football players, they just waited. They halted play. And they said they were going to be serious like this. Whether they do that all the time in the beginning or not, we just need to make sure that if we can kind of keep some of the rules and regulations that's been placed upon us to still do sports, to still go back to school, to do things like that, then I think we're going to be okay. It's just that when you kind of go out and party, and you know what happens when you start drinking and partying, you're not wearing a mask. You're not wearing a mask, you're really close. As you get older, you're yelling and screaming and singing and dance, and it just doesn't turn out well. So just be mindful of that. But I think we will get beyond this. Just hang tight, and hopefully we won't crash and burn. Hopefully we'll get to the other side with our population immunized, either by herd immunity or a vaccine.
All right. Well, if nobody else has any questions, just want to announce, and Jack, you'll be interested in our October meeting. Next meeting, we have our friends that's been there, Tony from Ving, doing emerging trends in safety technologies. But we have a friend of Ben's who he can tell you about it, going to talk to us about immune systems and how we can ramp up our immune system in October. Ben, you want to tell them about that one?
Sure. His name is Dr. John Sottery. He's somebody I worked with at Procter & Gamble. He was an exploratory research scientist. He left Procter & Gamble when we moved down here from Cincinnati from Connecticut. He originally was from the Cincinnati area. Graduated from Duke University, is actually has a Facebook page, actually started his own company. He's a very, very smart individual and is world renowned. He actually talks at any kind of pharmaceutical doctors, but he looks at the research and dissects it, and basically looks at it, and he can put it into layman's terms, but he talks about what kind of healthcare, what can you do to keep yourself from getting this kind of thing. Vitamin D was a big thing, and he talks about why vitamin D. So he is going to be speaking in the October meeting. I got a hold of him. He waived his fee for me.
Yay.
And he is fantastic, believe me. I'm sure we're going to get all kinds of people from all over the country when he presents.
That's cool. Yeah, zinc. I've heard zinc is another one. I'm sure it's a lot of, as this moves along, I think we're going to just get better and better at fighting this virus since it's new. So. But I will, Christy, if I'm not, hopefully it'll be quieter. I keep saying that.
And a lot of people just appreciate the information, and we'll see everyone next month.
Thank you, Christy. I'm sending you this right now. So thank you. Thanks, Ben.
Thank you for doing this. Appreciate it.
You're welcome. Stay safe. Bye-bye.